Thanks for watching. Carpal tunnel syndrome can be disruptive, but with the right approach, it's highly treatable and in many cases reversible. Whether you're looking for lifestyle changes, wrist support strategies, or advanced surgical options like ultrasound-guided release, there is a solution that fits your needs. I am Dr. Rezaian, specialist in arthritis and rheumatic diseases. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources before making any health decisions. Do your hands feel numb, tingly, or weak, especially at night or after repetitive tasks? You might be dealing with carpal tunnel syndrome, or CTS. It's one of the most common nerve conditions affecting the hand and wrist. It's especially common in people who type a lot, perform manual work, or have underlying health conditions. Let's walk through everything you need to know. What causes CTS, how to recognize it, how it's treated, including advanced surgical options, and how to prevent it from coming back. Carpal tunnel syndrome occurs when the median nerve, which runs from your forearm into your hand, becomes compressed as it travels through a narrow tunnel in the wrist called the carpal tunnel. This tunnel is formed by bones and ligaments. When the soft tissues around the tunnel, such as tendons or synovium, swell or thicken, they can squeeze the median nerve. This pressure causes pain, numbness, and other symptoms in the thumb side of the hand. CTS can be caused by a variety of factors, sometimes working together: repetitive hand use, typing, sewing, lifting, assembly line work; poor wrist posture during work, sleep, or repetitive motions; hormonal changes such as during pregnancy or menopause; medical conditions, diabetes, hypothyroidism, rheumatoid arthritis, kidney disease; trauma or injury, wrist fracture, dislocation, or sprain; anatomy, naturally smaller carpal tunnel in some individuals; obesity increases pressure in the tunnel; family history, genetic predisposition. CTS usually starts gradually and may worsen over time. Common signs and symptoms include tingling or numbness in the thumb, index, middle, and part of the ring finger; pain or burning that may radiate up the forearm; hand weakness, especially when gripping or holding objects; difficulty with fine motor tasks like buttoning clothes or texting. A diagnosis is typically made based on your symptoms and a physical exam. Your doctor may ask detailed questions about hand use and symptom timing, perform specific provocative maneuvers including Tinel's sign, tapping over the median nerve to trigger tingling; Phelan's test, holding your wrists flexed to reproduce symptoms; check for thin or muscle weakness or wasting; order tests if needed; nerve conduction studies to measure how well the median nerve is transmitting signals; electromyography to evaluate muscle and nerve health. Treatment depends on severity and cause. Lifestyle changes and activity modification. Take frequent breaks from repetitive tasks. Use ergonomic keyboards, tools, or braces. Avoid prolonged wrist flexion like during sleep. Wrist splints, worn mostly at night to keep wrists in a neutral position, reduce nighttime symptoms and help prevent progression. Medications. NSAIDs like ibuprofen for inflammation and pain. Corticosteroid injections for targeted relief in moderate cases. Physical and occupational therapy includes nerve gliding exercises, wrist stretches, training in ergonomic adjustments for home or work. Alternative and complementary therapies. Acupuncture, yoga, or chiropractic adjustments may provide relief in some cases, although scientific evidence is mixed. If conservative treatment fails, or if symptoms become severe, surgery may be recommended. There are now several options: open carpal tunnel release, traditional surgery with a small incision in the palm. The surgeon cuts the transverse carpal ligament to create more space for the nerve, done under local anesthesia. Recovery takes several weeks, may be preferred in severe or complicated cases. Endoscopic carpal tunnel release, 1 or 2 tiny incisions are made. A camera is inserted to guide cutting tools. Allows for less tissue trauma, faster recovery, and minimal scarring, often preferred in mild to moderate cases with quicker return to function. Ultrasound-guided incisionless carpal tunnel release, a minimally invasive technique using a needle-sized device guided by real-time ultrasound. The ligament is released through a micropuncture. No stitches, minimal trauma. Usually performed under local anesthesia in an outpatient setting. Same-day hand use is often possible with minimal downtime. Suitable for early to moderate CTS and gaining popularity in advanced centers. Comparing surgical options. Open surgery, incision size 1 to 2 inches. Recovery time weeks. Scarring moderate. Visualization direct vision. Ideal for advanced or recurrent CTS. Endoscopic surgery. Incision size small under 2 centimeters. Recovery time days to 1 week. Scarring minimal. Visualization camera guided. Ideal for faster return and less tissue trauma. Ultrasound-guided incisionless. Incision size under 3 millimeter. Recovery time 1 to 3 days. Scarring nearly none. Visualization, real-time imaging. Ideal for early CTS and outpatient treatment. Carpal tunnel syndrome is more common in women, especially during pregnancy. Adults over age 40. People with diabetes, thyroid disease, or arthritis. Manual laborers and repetitive hand users, individuals with a family history of CTS. While you can't always prevent CTS, you can lower your risk. Maintain neutral wrist posture. Use ergonomic tools and avoid prolonged wrist flexion. Take breaks and stretch if doing repetitive work. Keep chronic conditions like diabetes or thyroid disease under control. Use splints at night if symptoms are mild or intermittent. You should seek medical advice if symptoms interfere with daily life or sleep. You feel weakness in your hand or are dropping objects. You notice shrinking of thumb muscles. Symptoms do not improve with rest, splints, or other conservative measures. Carpal tunnel syndrome can be frustrating, but it's very treatable, especially when caught early. From lifestyle changes to advanced surgical options like endoscopic or ultrasound-guided release, there are a variety of effective treatments available. Don't ignore persistent hand symptoms. Early action can help prevent permanent nerve damage and get you back to living, working, and enjoying life without hand pain. If you found this video helpful, please consider liking, subscribing, and sharing it with someone who might benefit. Take care, and I'll see you in the next video.